Here with Penny Asbell. Penny, you're involved in a project called SHOW. Can I get you to talk about that a little bit?
Sure, Josh. You know, it's really important. As you know, I'm real interested in dry eye disease. It's a very common problem, maybe actually the most common problem that people seek vision care. And it turns out maybe 1 out of 10 patients with dry eye disease actually has Sjogren's syndrome. So it's an autoimmune disease. It involves not just the eyes, not just dry mouth, but also the body as well. In fact, maybe 5% of patients go on to have lymphoma. So we're really excited about a possibility of diagnosing it early. And that's been the problem. You know, if you follow these patients, they go to one doctor, then another doctor, they see rheumatology, they see ophthalmology, and it averages 5 years till they get a diagnosis. So here we have now a possibility of an early diagnosis with really a relatively simple test. It's biomarkers, it's antibodies that appear when you have Sjogren's syndrome, maybe earlier than other biomarkers that have been looked at. You take a little drop of blood, kind of like diabetes testing, put it on a strip of paper, mail it to a company in Buffalo, which of course I'm proud of because Buffalo is my alma mater. Anyway, they look at the blood sample, they analyze it, and they tell you Sjogren's or not. So we may really have an early test for diagnosing Sjogren's syndrome and the opportunity to treat these patients much earlier.
But Penny, aren't there markers for Sjogren's now? How does this one differ?
Okay, there are definitely markers, but you know, they only have about a 50% rate of accurately diagnosing whether somebody really has Sjogren's. And some of them, the biomarkers are so-so, but then sometimes they recommend a lip biopsy, which is not really dangerous, but it's certainly painful and invasive. So adding these extra biomarkers seems to add more sensitivity and specificity, so you have a maybe 80 to 90% chance of accurately diagnosing Sjogren's syndrome. So it's really a simple way, minimally invasive way to get an early diagnosis and perhaps early treatment to help a patient rather than doctor to doctor over, you know, a number of years.
Right, and the point is too that with dry eye with these patients, that if you establish this diagnosis, that you can move from just local therapy to systemic therapy that can really change things.
And then the other thing is, if you're a company developing treatment, if you have a good diagnostic tool, you can enter the right people at the right time and really figure out what works best for them. So I think that's really important, and that's a big opportunity to really address what's a significant problem from a patient's point of view.
Penny, let's shift gears now. Let's talk a little bit about CLAO. I mean, you've been at the center of CLAO since. Since CLAO.
Right. I've been doing. I think I have one of the largest annual meetings they ever have, and they continue to be dedicated to education. Now they do contact lenses, of course, but all of the corneal issues related to contact lenses: ocular surface disease, keratoconus, UV cross-linking. In fact, tomorrow we're running a symposium at the annual meeting on particularly keratoconus, and we're having an annual meeting next year in 2014 in Toronto. A whole vast number of subjects, obviously contact lenses, but all the other issues related to appropriate use of them. And I'm putting together a symposium on UV cross-linking, since every keratoconus patient wears contact lenses, but all of them, we would like them to not progress and actually get better vision if possible, even with spectacles. So CLAO's really still in the mix and still an important opportunity for education.
It's a big deal, not only for people in clinical practice, but as a teacher, I can tell you, I don't think that residents get adequate contact lens training.
They really don't. They actually don't. And you know, there's probably about 30 to 40 million people in the United States wearing contact lenses. So no matter where you practice ophthalmology, no matter what you call your specialty, you're going to see a few of them. Yeah. In fact, some of them are going to be your family members. So you really want to know something about them. And I'm proud to say I just became the editor-in-chief of Eye and Contact Lens, which is the journal arm, if you will, of CLAO. And we're delighted to take articles on all sorts of cornea, contact lens, and anterior segment issues. So we really look at it as a premier journal in giving information on this area. So CLAO, Eye and Contact Lens, keep them in mind when you're thinking about good information.
Fantastic stuff. Penny, thank you very much for spending time with us today.
It's been great. I really enjoyed it and look forward to doing it again. Yeah, it's fun.